This company were a technology-assisted agency who operated an online platform to connect self-employed care workers with private clients seeking care. Part of their mission was to help families to access suitable care, but also to ensure care workers were paid well. As an agency, the company was not CQC registered, but had its own internal monitoring system based on the CQC framework. The company were constantly recruiting, and applicants needed to have at least 1 year's experience in a formal care setting. The model required that there were many more care workers registered on the platform than people seeking care, meaning that it was highly competitive to bid for work. It was therefore not unusual for care workers to be registered on several different agencies simultaneously, even if they were not actively looking for work. For some of the care workers that we spoke to, this was not their only job. Being self-employed, the job was very precarious due to sudden changes in clients' circumstances. Care workers could set their own level of pay. However, the company had found that they needed to put guidelines in place for pricing levels. This was to assist care workers to ask for a fair price in relation to their experience and the complexity of people's care needs, but also to combat instances of racism. Self-employment meant that there was no entitlement to holiday or sick pay, and any travel expenses were negotiated directly with the client or family representative. Additional benefits offered by the company included an agreement with an accountant to offer a reduced rate on helping to submit tax returns to HMRC, and the opportunity to take out public liability insurance, which could be deducted as a percentage of earnings per week. This meant that care workers only paid for the insurance on weeks when they worked. Care work was available on a day visit or live-in basis. Daycare was offered on a minimum 3-hour visit in order to make it worthwhile for self-employed workers. Live-in care was based around a 10-hour workday with 2 hours break time, and it was expected that they would rarely be disturbed at night. Some live-in care workers told us that clients and families often didn't understand their right to breaks each day, and there was a blurring of lines between paid work and non-work time. They said that they sometimes felt that they were never off duty, as you always needed to be alert when caring for vulnerable people. Some live-in care workers told us that it could be difficult to organise their own health appointments, such as dentists. However, some live-in care workers particularly liked to be able to organise their own work so that they could work intensively over several weeks or even months, which allowed them the opportunity to have extended holidays. The care workers had the autonomy to develop and negotiate their own care plans with clients, although some did this on a very informal basis. Task diversity could range from companionship, including support to go out the house, domestic services such as cooking and cleaning, to personal care. Care workers said it was important to understand what was being asked of you when taking on a client, as the only training available through the company were generic training modules.